In this video, our subject is transferring patients and residents. We will discuss getting ready, safety considerations, how to transfer a person from bed to wheelchair, how to transfer a person from wheelchair to bed, how to transfer a person between bed and stretcher, how to transfer a person using a mechanical lifting device, and finishing up. As a nursing assistant, you will frequently assist patients or residents with transferring, that is, moving from one place to another. For example, those in your care may need to transfer from the bed to a wheelchair and back again, or between a wheelchair and a dining chair or commode. During transfers, you will need to keep your patients or residents safe, while at the same time protecting yourself against injury. By developing competence in assisting with transfers, and by practicing good body mechanics, you increase the chance that everyone will come through the procedure safely. Preparation, that is getting ready to manage your work in a manner that is safe, healthful, and efficient, is key to successful health care. No matter what tasks you'll be performing during your shift, whether those tasks are planned or unanticipated, you will benefit from a routine of careful preparation. Begin each interaction with patients or residents by performing these steps. Wash your hands. Gather all needed supplies. Knock before entering the person's room. Introduce yourself using your name and title and greet the person by name, remembering that a friendly greeting helps establish rapport. Carefully identify the person adhering to your facility's approved method. Explain to the person the procedure you're about to perform and make sure the person understands before you begin. If necessary, show visitors where they can wait outside the room. Provide privacy by closing the door and curtains. As appropriate, drape the person for modesty. And then, throughout the procedure, see to safety using proper body mechanics and following all safety precautions for equipment use and infection control. Here are some additional getting ready steps you should take whenever you transfer a patient or resident. Before you start a transfer, even a simple one, plan the transfer. Ask the nurse or physical therapist about any limitations the person has and what the recommended transfer method is. Get help from others if necessary, especially with heavy lifting. Consider using assistive equipment such as a transfer belt or mechanical lift. Make sure all wheels are locked on beds, stretchers, and wheelchairs to prevent the equipment from rolling out from under the person. And finally, move furniture out of the way before you start. No matter how thoroughly you carry out your getting ready steps, you must still pay close attention to safety during the transfer. Unfortunately, accidents are common during transfers, with potentially serious consequences. But if you follow a set of safety guidelines, such as those that follow, accidents can be minimized or even avoided altogether. To keep patients and residents safe during transferring procedures, follow your plan, whether you're working alone or with assistance. Remember to give the person clear instructions and encouragement throughout the transfer. Make sure the person leads with her strong side if possible. Make sure the person's clothing doesn't interfere with the transfer, and that shoes provide support and have non-skid soles. Have unsteady people grasp your arm or the arm of the chair for support. Do not allow the person to hold you around your neck. To help support the person, place your hands either on the transfer belt or behind the person's upper back. Do not place your hands under a person's armpits to help support her, because if the person falls, she may be injured when you lift up as she is falling down. It's important to note that some patients or residents may have medical conditions that make it dangerous to use a transfer belt on them. For example, a transfer belt should not be applied to a person who is recovering from abdominal surgery. Transfer belts are also not used with people with certain heart disorders. If you are in doubt about using a transfer belt on a patient or resident, ask the nurse. The key to your safety whenever you transfer a person, and another great way to prevent injury to patients and residents, is to observe good body mechanics. Body mechanics are the way you align, balance, and coordinate your movements, and they're as easy as ABC. A for alignment, B for balance, and C for coordinated movement. Think of the A, or alignment, as good posture. Keeping good alignment through good posture lessens strain on your joints and muscles. Specifically, good alignment keeps your back in a neutral position. B, or balance, involves a wide base of support and a low center of gravity. When you're standing, the base of support is your feet. Separating your feet makes your base of support broader. Your center of gravity is your torso, the heaviest part of your body. Bending your knees puts your center of gravity lower, closer to your base of support. This also takes strain off your back. C, or coordinated body movement, uses the weight of your body to help with movement. This might be as simple as straightening your knees, allowing the momentum of the movement to assist you in your task. During a typical workday, you are likely to assist with transfers many times. And because transferring consists in large part of lifting, you will risk serious injury to your back if you don't use proper technique. And back injuries can be painful. Moreover, they can be serious enough to end your career. You see, the muscles of your back are not designed to lift weight. That's why you see competitive weightlifters using their leg muscles, then their arms and shoulders. In other words, they use good body mechanics, and so should you. When transferring, you will vary the degree of assistance you provide depending on the person's ability to help with the transfer. That is, the person's ability to bear weight, and whether the person can bear weight on one leg or two. Perhaps you will only need to provide a steadying hand, or you may need to totally lift the person from one place to another. When helping a person to transfer, you must consider all factors that may affect the person's weight-bearing ability. For example, surgery involving one or both legs may limit the person's ability to bear weight, as will leg paralysis due to a stroke or other injury. In short, know your patient or resident and never assume anything about the person's abilities. Before proceeding, make sure you have checked to see what type of assistance the person will require. Then, make sure you use the proper equipment to assist with your transfers according to the specific needs of the person, using, for example, a transfer belt or mechanical lift. Remember, a transfer belt is never used to lift a person who cannot bear weight. A person who is unable to bear weight should be moved with a mechanical lift device. For safety, make sure you have been trained in the use of these devices before you use them. Finally, you will complete your attention to safety when during the transfer you tell the nurse right away if the person complains of dizziness, shortness of breath, chest pain, a rapid or irregular heartbeat, or sudden head pain. The person complains of pain when he or she tries to bear weight and this is new. You observe any changes in the person's usual grip, strength, or ability. A usually cooperative person refuses to participate, and tell the nurse if the equipment is not working properly or is broken. To transfer a person from bed to wheelchair by yourself using a transfer belt, begin as usual by gathering your supplies, which in this case are a transfer belt, a wheelchair, a safety belt if ordered, and a lap blanket if needed. Lower the bed to its lowest position. Raise the head of the bed as tolerated.
Feeling dizzy at all?
No.
Okay, cool.
Then make sure the bed's wheels are locked for safety. Next, lower the side rail on the side of the bed next to the person's strong side. This is the side you'll be working from. Leave the opposite rail up. Fan fold the top linens to the foot of the bed. Now position the wheelchair next to the bed, facing the foot of the bed. If possible, brace the wheelchair against a wall or solid piece of furniture to keep it in place. Lock its wheels and position the footrests out of the way. Help the person to move toward the side of the bed where the wheelchair is located. Then, help the person sit on the edge of the bed. To do this, first have the person roll over onto her side, facing the side of the bed where the wheelchair is located. Have the person flex her knees and position her arms as shown to enable her to prop her upper body up and push off the bed. Now ask the person to rise to a sitting position by using the elbow of her bottom arm to raise her upper body while pushing against the mattress with her other hand. Advise the person to allow her legs to swing over the edge of the bed while you help guide her into an upright position. Next, allow the person to dangle or rest in this position for a few minutes before helping her to stand up. This helps equalize blood flow after a person has been lying flat for a long period of time. Make sure the person is sitting squarely on both buttocks with her knees apart and both feet flat on the floor. The person's arms should rest alongside her thighs. A note of caution: if the person is rushed through this step or not allowed to rest at all, she may become dizzy and fall while attempting to stand, so allow her to sit for several minutes before proceeding. Observe the person for signs of dizziness or fainting as you position yourself in front of her so you can offer assistance in case she loses balance. And remember to ask the person if she feels dizzy or faint.
How do you feel dizzy or faint at all?
No, I don't. I feel fine.
Okay.
If she does, assist her back to a supine position before notifying the nurse. Next, help the person put on her shoes or slippers and help her into a robe. For safety, make sure that clothing doesn't interfere with the transfer. When the person is ready, apply the transfer belt around her waist, over top of all clothing. Buckle the belt in front. Before you tighten the belt, turn it so the buckle is off-center, perhaps even off to the side. Tighten the belt and check for fit. It should be snug, but you should be able to slip your fingers between it and the person's waist. If you're putting the belt on a woman, make sure you do not trap her breasts beneath the belt. Next, assist the person to the place she is going, in this example, to her wheelchair. Help the person to stand by facing her and having her put her hands on the edge of the bed. Make sure her feet are flat on the floor. Then have her lean forward. Grasp the belt at each side, using an underhand grasp for safety. Position your feet alongside the person's feet, flexing your knees. Your shins will be against the person's shins. This technique helps to block the person's feet and keep her knees from buckling as she stands up. Have the person push down on the bed with her hands and stand on the count of 3.
On the count of 3, I want you to push down on the bed and try to stand, okay?
Pull on the transfer belt as you straighten your knees.
3.
Remember to keep your back straight. Support the person in the standing position by holding the transfer belt or by keeping your hands on her shoulder blades. Continue to block the person's feet and knees with your feet and knees. Help the person to turn by pivoting on the stronger leg toward the chair. This will allow the person to grasp the far arm of the wheelchair. Make sure the backs of the person's legs touch the edge of the chair. Continue to assist the person with turning until she is able to grasp the other armrest. Then, gently lower the person into the wheelchair by bending your hips and knees. Make sure the person's buttocks are at the back of the chair and that the person is comfortable and in good body alignment. Now, remove the transfer belt. Position the person's feet on the footrests of the wheelchair. Buckle the wheelchair safety belt if one was ordered. And cover the person's lap and legs with a lap blanket if desired. But make sure the lap blanket does not drag on the floor. Position the wheelchair according to the person's preference. Then complete your finishing up steps as described in the final section of this video. To transfer a person from a wheelchair back to his bed by yourself and using a transfer belt, begin as usual by gathering your supplies, which in this case is a transfer belt. For safety, make sure the bed is lowered to its lowest position. Make sure the bed's wheels are locked for safety. Then, raise the head of the bed. Fan fold the top linens to the foot of the bed. Then, make sure the side rail on the working side of the bed is down, while leaving the opposite rail up. Now you are ready to position the wheelchair. If possible, brace the wheelchair against a wall or a solid piece of furniture to keep it in place. The person's strong side should be next to the bed. Lock the wheels of the wheelchair and position the footrests out of the way. Remove the person's lap blanket if one was used and release the wheelchair safety belt if in use. Next, apply a transfer belt as demonstrated earlier in this video. Now stand facing the person with your feet spread about 12 inches apart and with your knees slightly bent to protect your back. With your back straight, slide the person to the front of the wheelchair seat. Make sure the person's feet are flat on the floor. Grasp the transfer belt. Position your feet alongside the person's feet, flexing your knees. Place your shins against the person's shins to block his feet and to keep his knees from buckling as he stands. Have the person rest his hands on your arms and assist him to stand by pulling on the transfer belt as you straighten your knees. If the person requires less assistance, he can place his hands on the wheelchair arms for support and push off while you offer support. If use of a transfer belt is contraindicated for your patient or resident, you can assist the person into a standing position using a different technique. Place your hands on the person's upper back and gently pull him up and forward as you straighten your knees. No matter which method you use to assist the person out of the chair, remember to keep your back straight as you are doing it. Slowly help the person to turn toward the bed by pivoting on his strong leg. Then, help the person to sit on the edge of the bed. Now, remove the transfer belt. Remove the person's robe if appropriate. Then his slippers. Next, move the wheelchair out of the way. Place one of your arms around the person's shoulders and one arm under his legs. Swing the person's legs onto the bed. Help the person to move to the center of the bed. Then, position the head of the bed to the level that's comfortable for the person. Straighten the bottom linens and make sure the person is comfortable and in good body alignment. Draw the top linens over the person and make sure the call light control is within reach. If the side rails are in use, return them to the raised position. Then, complete your finishing up steps as described in the final section of this video. Stretchers are used to transport people to other parts of a facility for surgery or diagnostic testing. Critically ill and comatose people are also transported on stretchers. To transfer a person from a bed to a stretcher, begin with your getting ready steps. You will need 3 co-workers to assist you, and you will need to bring a stretcher with a bottom sheet in place. You will also need a blanket with which to cover the person, and a lift sheet in position on the person's bed. After identifying yourself and your co-workers to the person, and after explaining the procedure, raise the bed to its highest level. If there aren't any contraindications, lower the head of the bed so that the bed is flat. Make sure the bed's wheels are locked. Lower both side rails. Then, fan fold the top linens to the bottom of the bed. If necessary, untuck the lift sheet in preparation for transferring the person. Position the stretcher alongside the bed. It should be slightly lower than the bed. Lock the stretcher wheels. If stretcher safety belts are in use, move them out of the way. Make sure the lift sheet is positioned so that it is under the person's shoulders and hips. As shown here, 2 assistants stand on one side of the bed facing their co-workers, who are positioned along the outside edge of the stretcher. All 4 assistants should grasp the edge of the lift sheet and roll it over as close to the person's body as possible. This will provide for a better grip. On the count of 3, all 4 assistants slowly, carefully, and in unison lift up on the lift sheet and move the person to the side of the bed. Then, again on the count of 3, all 4 assistants lift up on the lift sheet and move the person to the side of the stretcher. Next, position the person on the stretcher and make sure he is in good body alignment. Reposition the pillow under the person's head and drape him with a blanket for modesty and warmth. If necessary, buckle the stretcher safety belts across the person and raise the side rails on the stretcher. Raise the head of the stretcher as the person requests. Then, complete your finishing up steps as described in the final section of this video. For safety, always transport feet first and never leave the person alone on a stretcher. To transfer a person from stretcher to bed, you will reverse the procedure, making sure to observe all safety precautions. A mechanical lift is used to move people who are helpless or very heavy. Before using a mechanical lift, always make sure the person you need to transfer weighs less than the weight limit specified on the lift, and follow all your facility's policies on operating the lift. Many facilities require 2 staff members to operate a mechanical lift. Make sure you know your facility's policy. And though we're about to demonstrate the use of a lifting device, don't attempt this yourself until you've been trained on the device in your facility. Begin with your getting ready steps. Part of that is gathering your supplies, which in this case includes the mechanical lift, a sling, wheelchair, lap blanket if needed, and lap restraint if ordered. You should also ask a coworker to help. Begin by making sure the bed is positioned at a comfortable working height to promote good body mechanics. Make sure the bed's wheels are locked. If the side rails are in use, lower the rail on the working side of the bed. Fan fold the top linens to the foot of the bed. Using the same technique as when placing a lift sheet while making an occupied bed, place the sling underneath the person, positioning the sling between shoulders and knees. The sling's lower edge should be under the person's knees. Raise the lift so it can be moved over the person. Move the lift into position over the person. Then lock the wheels. Attach the sling to the swivel bar. Cross the person's arms across his chest. Raise the lift until the person and the sling are clear of the bed. Then raise the person. Place the wheelchair alongside the bed, facing the head of the bed. Lock its wheels and position the footrests and armrests out of the way. Turn the person so he is facing the mast of the lift and his body is centered over the base. Next, unlock the wheels of the lift and move the lift so the person is over the seat of the wheelchair. Spread the legs of the lift apart as necessary in order to straddle the wheelchair. The person's back should face toward the wheelchair. Next, gently lower the person into the wheelchair. Make sure the person's buttocks are at the back of the chair. Release the sling from the swivel bar. Then move the lift out of the way. Leave the sling under the person so it's ready for his return to the bed. Reposition the wheelchair's footrests and armrests and put the person's feet on the footrests. If a lap restraint was ordered, position it now. Otherwise, provide a lap blanket as needed, making sure it doesn't drag on the floor. Finally, position the wheelchair according to the person's preference. Then complete your finishing up steps as described in the final section of this video. When you have finished with a procedure, always follow a routine of finishing up to ensure your patient's or resident's safety and comfort. First, confirm comfort and good body alignment, whether the person is seated or in a bed. Leave the person's call light control within easy reach, and do the same for any other items the person may want, such as remote control devices, the telephone, or fresh water. Next, see to safety. If appropriate, return the bed to its lowest position. Then, make sure the wheels are locked for safety, and place the side rails in ordered or requested positions. If desired, open the curtain or door and ask whether the person would like for visitors to return. If you used gloves, first discard them according to your facility's policy. Then, wash your hands. Finally, report and record all pertinent information about the procedure, including the date and time of the procedure and your full name and title.